Thank you to the founding sponsor of Undivided, 1530 Mortgage. Visit them at 1530mortgage.com. As you know, we've been talking about on the show, and also, of course, nationally, there's a conversation about what to do to prevent mass shootings in this country. That, of course, follows the murders of 19 children at an elementary school in Texas. They were gunned down by an 18-year-old who is clearly very emotionally troubled. But while a lot of politicians are focused on issues related to guns, Republican State Representative Kelly Chambers is focused on issues related to the heart and mind. She believes it's time to repeal a state law that makes it more difficult for parents to know what's going on with their kids. So you reached out to me about this because I had put out a kind of a call to subscribers asking for ideas to prevent mass shootings. And I feel like you reached out to me more as a mom than as a representative. So if you're willing, I wanted to talk a little bit about your background and why this is an issue that you're so passionate about.
Sure. Well, yeah, I am a mom and a auntie. I've got 3 kids that are all adults and adulting very well. But I have 9 nieces and nephews. And, but I became a parent very, very young. I was 16 when I got pregnant in high school, and I had my daughter my junior year of high school when I was a class president. So I was kind of, just I'd say headstrong teenager, wanted to do whatever I wanted to do. Which is part of why I was, pregnant at 16. But in the midst of sort of that chaos of maybe doing things out of order or taking the hard road, I really wanted to make sure that I raised my daughter in a way that was different, and that she could always, come to me, and that that there was a open lines of communication. And so some of the stuff that I've seen as a legislator, I think it just comes down to, I think it's separating parents from their kids, and that's the wrong direction to be going, because, kids can be in crisis. And I think that's when they need their families and support of their loved ones more than ever. So,
yeah. And it's fair to say that not all parents have, kids, and it might not be the parent's fault. It might not be the child's fault, but maybe there's not that sharing element where if something's wrong, the kid's automatically going to go to their parent. So in the context of your personal experience, you told me about how when there was debate on Senate Bill 5889, it was very upsetting to you. So just re-explain. I know viewers and listeners will be familiar with this bill, but explain what it did.
Right. So 5889, what it does, it's called it was referred to as the explanation of benefits bill. So when you have health insurance, you see a provider, usually there's a form that gets mailed to you that indicates that you had, had a doctor's visit, and that it'll usually say, this is not a bill, like your provider is going to bill you separately for that visit. And so what this did was it changed it so kids who are 13 years and older, and they can self-direct their medical care, those explanation of benefits, even though the child may be on their parents' health insurance, that explanation of benefits now will go directly to the child and not to the parent. And it was one of those things that in the legislature, I was opposed to it. And I had some concerns with it, but I don't think it hit like the average person's kind of kitchen table until after the law had gone into effect, and suddenly parents were getting messages from their insurance company saying, as of this date, you will no longer be able to access your child's health information. And then it became maybe more widespread that people were waking up and saying, what is this? Well, it had long been passed since it came to people's radar.
Yeah. And parents, it's their insurance. They're still being billed for all this stuff, but they don't get to know, if the child chooses to cut them out of it, they don't get to know what their child saw someone for. Correct.
Right. And, normally when we have a bill, you read the bill and make your determination on how you're going to vote. For this one, I was suspicious about it. And I, did some research. Is this really good public policy? Is this good for kids? And in my research, I came across a study from the American College of Pediatrics that you get better health outcomes for kids when parents are involved. And that just runs the gamut, whether your kid is getting a root canal or more serious medical treatment, let's say cancer treatment or something, you're going to get better health outcomes when parents are involved in your kids' care. And I think of just sort of modern day challenges of what kids are going through right now. Substance abuse is huge, and mental health challenges, whether it be depression or anxiety. These are things that kids are commonly going through, and I think times when they're going to need their parents the most. And the state is systematically cutting parents out of that, being involved in that.
Well, and one of the arguments when I went back and did a little research about the necessity for this is Democrats mostly argued that if you're a teenager and you're having, mental health issues or depression, or maybe you're abusing substances or you're sexually active, that you are more likely to seek out help if you can hide it from your parents. And so they thought they were getting rid of some sort of stigma for kids where it's like, oh, I can go get treatment for an STD or I can see a therapist without telling my parents. And so I'm more likely to do that. Do you find any sort of relevancy in that argument?
Well, that's sort of the double-edged sword is that, some kids may, let's say an STD, for example, they may be able to go and get treatment without their parents' knowledge. But at the same time, you have to look at things that are more serious. If your child is suicidal and having thoughts of harming themselves or harming somebody else, do we want to set up a system in which parents cannot ever know that? And I think that is the piece that's wrong. But, as, comparing, my daughter's 29, back in the day, there was all this argument, should we, allow teenagers to access birth control? It was very controversial. But as we've progressed and everybody has a smartphone, kids have access to so much more information now just at their fingertips. So I think that has helped, bring down some of those numbers of, let's say, teen pregnancies, for example, than it was 30 years ago when, my high school, they called that a pandemic.
So this came up, as I said earlier, in the context of school shootings and mass shootings in this country. Why do you find relevancy here between this bill and this separation between parents and kids and what's happening in our country?
I think there has to be something seriously wrong with somebody that would shoot their grandmother in the face. And, to see, in that case in Texas, the grandfather saying, he would never steal, he would never do these things. Like, clearly there was a gap there between what this person, ended up doing and what this perception is that you never thought they were, could be capable of something like that. So in the context of mental health, I would like to see parents be more engaged with their kids, health and their healthcare providers, and providers providing information to parents so they know which warning signs to be looking for. Being isolated, lots of screen time. These are things that families of kids need to be looking out for. And you don't have to have a perfect family in order to look for those things. Not everybody has a 2-parent family, but single parents, grandparents raising kids all need to be equipped with the information and signs to be looking for.
So what do you plan to do? Is this something that you think Republicans would try to revisit in the coming session?
I think everything's on the table. I had worked on a bill before about providing kindergarten readiness standards to parents of 3 and 4-year-olds so that you know what to be working with your child on before they enter kindergarten. And I'm kind of thinking along those same lines with mental health. How can we give parents the information that they need so that they can re-engage with their kids' healthcare?
Yeah, because you do have to have an engaged parent, because if the parent isn't engaged, it doesn't matter if the kid has to or doesn't have to tell them about what doctor they're seeing, because if they don't have a good relationship, the kid's just not going to tell them they need to see a doctor or a therapist.
Right. And, parents are still the most important person in a child's life and have the most time with them. So that's I think, relationship that should be nurtured. And I'd be happy to talk about any ways to do that.
When you were a young mom, do you think a bill like this would have hurt your relationship with your daughter?
Possibly, because I remember my daughter kind of becoming a teenager and they pushed those boundaries and I was just very adamant of these are going to be the rules, and the rules apply whether you're at home or you're at your dad's or you're at school. This is my expectation for you. And, I just parented in a way with here's privileges and with that comes responsibility. And, if you don't meet your responsibilities, then the privileges go away. So I was pretty fortunate. I don't want to say my daughter's perfect, but close to it.
If you like videos like this, be sure to become an undivided subscriber on my Patreon or Locals pages. That's patreon.com/undivided or brandykruse.locals.com. Thank you to the founding sponsor of Undivided, 1530 Mortgage. Visit them at 1530mortgage.com.